Aloha everyone, this is Dr. Analis, resident osteopathic family physician here in Seattle, Washington. Here for another video for our Indigenous Minded YouTube channel. Just get right into it. Thank you again everyone for the support and continuing to watch. So I'm picking up from last week. It was a transition week. I was finishing the last few days on our family medicine service. So I had, Monday was a short call shift and I was there kind of most of the day, and had to do some interim summaries to help prepare the next team that was taking over for some of the patients that have been there a while, just to have like a good note of like understanding the patient's like progress. Tuesday was a long kind of my day call, and it was kind of long. We had a few admissions, and that was kind of the big thing. I was a little bit worried about starting OB, not being able to have like making sure I was getting enough rest and had time to review some stuff. But that went okay. My senior really helped me finish up some stuff that night so I can get home. Wednesday started, and our OB service is a little bit different. It's a little bit interesting. We have a lot of different providers, family docs, OBGYNs that have like different groups, and we have like a color code system that can make it a little bit difficult sometimes to try to like understand like what, when a patient comes in, which group are they assigned to, which attending, and some attendings don't work with residents, and understanding that. So that was interesting to first come into. And like with our first few shifts, we have buddy shifts, so we have like a senior that's next to us kind of guiding us and show us the way. So my first day was a postpartum day, so I'm seeing patients that recently delivered and like their babies as well. And it kind of depends, because sometimes if a different doc saw the patient and did like a C-section, we wouldn't necessarily see them sometimes, and it's interesting. And with a lot of our deliveries that are uncomplicated and that go well, usually you can go home within 24 hours. So part of our job is seeing them, staffing with the attending, and being like, okay, yeah, they can go, and making sure we're trying to line up appointments, follow-ups, and medications, and all that kind of stuff. So it was a lot to kind of take in that first day, and just kind of a general overview of everything and where the patients are, on different floors and where. And but that was a good day. I had really good advice from my senior. I was able to kind of put that all together. And it can go pretty quickly if you're able to do things in the morning. And we usually have like during the week teaching, so it's just like you're trying to time up everything as well. And then we usually have a few other shifts. We can have a shift where you're working with a lot of the OBGYNs, or you could be working with a lot of the family docs. And then we also have like a night shift, at least as interns right now. So the next day I was working with the OBGYNs, and it was a good day. I had another senior as well. Had a few active patients, had a few deliveries, which were great. Just learning how we like document and do, especially OBGYN, we try to, our OB rotation, we try to document things that are happening as they're progressing. As we're doing cervical exams and seeing how far moms are dilating, getting ready and closer to like pushing and delivering, and any medications that we're giving, any like things that might have changed are important to document so we can keep track and understand how things are flowing. And then we just have like fetal monitoring, like strips everywhere, like on monitors and like in our EMR medical records, and just keeping track and trying to see how baby's doing and how mom's doing, and if anything needs a change, if you need to change positioning, give fluids or oxygen or medications, seeing how things are progressing. And every doctor is a little different, how they feel comfortable with certain things or not. What's interesting about the service too is we have like a laborist that is like an OBGYN that oversees kind of the whole service and can come in case things are progressing a certain way, or if we need to do like a C-section, a cesarean delivery, or a crash C-section, or consult if they need advice, which is great to have. So yeah, that OBGYN did, I was able to be a part of a few deliveries and learn kind of, and they went well, and learn the techniques from those doctors, working with them. So that was great. And then just learning the general overall flow with my, lucky to have a buddy as well. It's pretty busy. We had a few, like I think we just had like one, and then you also like covering triage. So like as patients are coming in, ruling out like labor or preterm labor or anything that could happen in pregnancy. And then the next day I was working with mostly family docs, and I had a buddy shift as well, and it was a pretty busy day. I was pretty fortunate. I got to do a lot that day. Pretty good amount of procedures. I was able to do a few more deliveries, and I was able to do a couple procedures that are pretty cool to be able to do as an intern right away. Is placing a fetal scalp electrode. So a lot of times we're watching the monitors and we're not really sure if the numbers are as accurate, or if we want to make sure we're getting a more accurate picture of what's happening and how baby's doing in the uterus. We can place an electrode on baby's head. So I was able to do actually twice. And then I was actually able to help with another patient as well, is replacing an intrauterine pressure catheter. So that's another device that can go in the uterus to gauge how the contractions are going, how strong they are. and with one delivery, I was actually able to do a first degree laceration repair, which was great. And that patient, we're expecting a bigger baby, so we talked through things that could happen with the bigger babies, like shoulder dysocias, if like shoulder gets stuck, and working through kind of scenarios. And that was great, but it turned out everything was fine. And it was great to kind of run through and think through scenarios of what can happen and what you'd want to do. It's interesting working with different attendings and like how they like to deliver and how they like to, it's more stylistic on how they prefer to do certain things. I was able to do a few ultrasounds, so it's important to like determine if baby's head's down versus not, so it can change how you approach, delivery, or if you're trying to do different maneuvers to try to get, because the way that we like, most deliveries is the baby's back of the head is up towards mom anterior, so we call that OA, and having a smooth delivery that way, and it could change things if things happen differently. I was able to do a few artificial ruptures of membranes, so being able to basically break the bags of water with a few patients as well. So I was able to do a few good things. And then yesterday I didn't have a buddy and I was on my own, and it turned out to be a good day. I was very satisfied that I was able to kind of work through some things. We had a triage patient that we had to rule out like any type of abruption. So if you're ever in an accident or like have a fall, you want to check a few labs and do like an ultrasound, make sure there's not any bleeding, and usually have like monitoring and making sure everything is looking well. And that patient actually did well and was able to go. And then I was able to have another one that came in that was moving pretty quickly, and just knowing how to try to place orders in quickly. And luckily I did have seniors I can call on that were available, and then making sure those orders in. They wanted epidural, making sure things are happening quickly, and the attending came in quickly as well, so we were able to kind of work through that. And so I was able to have another delivery that went well. I was able to see the baby as well. As a family doc, we're able to do newborn exams as well. So, and then just understanding how to continue to log notes and be updating, like sign out for, when you're transferring over to the next person, and make sure I'm trying to do my part as much as I can, because things on OB can be like, things can change, and just being able to adjust and do my best to do my part. But it was a good week. It was a solid week, and I think can't really switch the camera right now, but again, it's going to be backwards, but this is just something probably more later for me, and it's like backwards, but it's everything I kind of listed out I got to do. So I got to do some kind of cool stuff. Had like 6 deliveries, and the scalp electrodes, the catheter. Doing the lac repair was great for me, just being able to suture again and working my hands, so that was great. And I was actually trying to practice my knots the night before, doing like the one-handed knot, which is great. And doing some of those ultrasounds and some of the other procedures like artificial rupture of membranes. And everything's been good, and just kind of, like I was saying, some rooms, and in some situations you have to move quickly if you're not able to do everything like you'd want to, like breaking down the bed, or during certain things you have to adjust based on the patient, the situation, and every attending is a little different and how they like to do things, and that was kind of great to learn. But yeah, excited. So I was off today on Sunday, and then I just kind of getting ready for tomorrow. And then I have one more shift, and actually I have a vacation this week, so I'm going to be able to visit family, Washington and Oregon. Hopefully, see a little bit of everyone, and it's nice to be able to have that. I'm trying to enjoy that for sure. Try to catch up on some things, life things. But that's pretty much the update for this week. So yeah, on OB and continuing to do, hopefully get some more deliveries and learn some more things. And I think the big thing for me is just trying to continue to understand triage, and as things come in, orders to put in and what to do, and some things that I haven't necessarily done yet, like ruling out preterm labor and things like that. Just being able to be confident. And it's just a different system. OB's, different than like working on the family medicine service, because you're not necessarily like rounding, it's like you see someone, you're trying to get their notes, and you're trying to be able to work with an attending, so staff with them and come up with a plan and try to learn from them, debrief on certain situations. And I think it's the biggest things to do. And yeah, so that's pretty much what's been going on. That's kind of the update. So yeah, thanks everyone for continuing to watch and support. Keep it mission minded, keeping it indigenous minded. All right, aloha.